Hi everyone, I'm Dr. Marta Perez, board certified OB-GYN, and thank you for coming to my YouTube channel. Today's episode is going to be about abortion. It's specifically going to touch on the Oklahoma recently passed abortion bill, but it's also going to cover a lot of different topics within that as well. I hope you stay tuned. I hope you learn something. This is a reproductive health issue that as an OB-GYN affects my patients deeply. And if you're tempted to make a rude comment, I would encourage you not to, but if you want to anyway, it just increases engagement on my evidence-based and very factual video so that more people see it. So you might want to think twice before you try to increase my engagement if you don't agree with it. But if you're open-minded and you think, well, I'd like to learn more about this from an OB-GYN doctor who thinks this is important, then please stay tuned. I also have a lot of information about abortion on my Instagram. I go over abortion and how it relates to religion, including my own. I go over a lot of the medical details about medical abortion or abortion procedures. And so please check that out. My Instagram is at Dr. Marta Perez. Thanks for coming, thanks for staying tuned, and thank you for listening respectfully. Even if you don't agree with me by the end, you should at least understand the true facts about abortion. Abortion has been big in the news lately, and that's because about a month ago, there was a leak of a Supreme Court opinion that may or may not come out very soon this month in June, showing that the Supreme Court is likely going to strike down Roe v. Wade. This would mean that the decision about the legality of abortion and access to abortion would be a state-by-state issue. It wouldn't be the inherent right of someone who was pregnant to decide whether or not to continue the pregnancy. We're gonna go over a lot about that. Already, abortion is severely limited in a lot of states, including states I've spent a lot of time in, like Missouri, where I currently work, and in states I will be moving to soon, Texas. Abortion advocacy for me has gone back a long time. Many years ago, I went to Jefferson City to serve as an expert witness in front of the legislature there about women's health issues when they were trying to pass bills limiting access to abortion. I also have done advocacy on my social media account, and I've written in op-eds. I'm going to link all of those below so that you can have access to them. But advocacy is really important to me as an OB-GYN doctor, because whether or not you personally feel like abortion has a place in your moral life, for many people it's morally neutral. And it is a really important part of reproductive health care. And there are very negative consequences for reproductive health if abortion is inaccessible and if it's difficult to access. So a little bit of background. On May 25th, Governor Stitt of Oklahoma signed an anti-abortion bill in Oklahoma. It was modeled very closely after the Texas bill that empowered citizens to be able to sue other citizens who aided and abetted in any abortion. The difference between this and the Texas bill is that this bill started at fertilization instead of at 6 weeks of pregnancy or at a clinically recognized pregnancy, and we'll discuss why that's problematic. There is also bills that are going probably to come up to Governor Stitt's desk that haven't yet, as of today when I'm recording, which is the first week in June, that would actually, instead of just empowering citizens to sue each other, it actually would make abortion a felony crime for anyone performing the abortion, but not the patients themselves. So let's go over the many ways that this bill is problematic and can negatively affect the health of pregnant people and women in Oklahoma and also in other places. The first problem is fertilization. So in this bill, they put the starting point as fertilization, meaning anyone who aids and abets the end of a pregnancy from any time from fertilization on can be sued. Now, this is hugely problematic because nobody knows when fertilization occurs. It is a scientifically, biologically unknowable event. Pregnancy can only be detected via a positive pregnancy test with the hormone beta-HCG, which can either be found via a blood draw or tested via urine. That happens after the pregnancy has implanted in the uterine lining. So just as a background or a refresher from biology class, a woman who has an egg releases an egg, and that process is called ovulation. When they release the egg is around, able to be fertilized for about 24 hours. Sperm can live in the reproductive tract for about 5 days. So intercourse, like 4 days leading up to ovulation and 1 day after can result in pregnancy. The egg and the sperm meet each other for fertilization in the fallopian tube, which are the two tubes on either side of the uterus. They are fertilized there, and then the egg travels down into the endometrial lining, where it implants in the endometrial lining. If it implants successfully, then a cascade of reactions happen, and beta-HCG, the pregnancy hormone, is made in increasingly high levels so that it can be detected in the blood and in the urine. There is no way to know when fertilization happens. In fact, human reproduction isn't actually that efficient. Although you hear many people say they got pregnant on the first try or the second try, human reproduction is a little less than 20% effective per cycle. It is normal for it to take multiple cycles to get pregnant. And we don't know how many times the result of not getting pregnant during a cycle is because fertilization occurred and the egg in its traversing down into the uterus never implants and just comes out of the body. It is a completely unknowable event. So to start a law that criminalizes or makes someone open to lawsuits starting at a completely unknowable event is clearly extremely problematic. It also reminds me of a movement that happened back in 2016 in Indiana. So at that time, then Governor Pence, the governor of Indiana, signed an abortion law that was limiting who could get abortions and when. It also had several other details about reproduction in there, like specific requirements for miscarried tissue. The remains of a miscarriage have to be interred or cremated by a facility having possession of the remains, regardless of the age of the fetus. And by the way, I wish this was just limited to this terrible law in Indiana, but it's actually really common. Unfortunately, as an OB-GYN doctor, I have to ask patients if they would like the remains of their miscarriage cremated or sent to a funeral home. It really makes a traumatic event for patients even more traumatic and is so inappropriate. Anyways, this law was passed in Indiana, and someone created a movement called Periods for Pence. So the movement started as a social media movement among Indiana women, and I'm just going to read you one of the quotes. Fertilized eggs can be expelled during a woman's period without a woman even knowing that she might have had the potential blastocyst in her, which is true, I just described that. Therefore, any period could potentially be a miscarriage without knowledge. I would certainly hate for any of my fellow Hoosier women to be at risk of penalty if they did not properly dispose of this or report it. Just to cover our bases, perhaps we should make sure to contact Governor Pence's office to report our periods. We wouldn't want him thinking that thousands of Indiana women a day are trying to hide anything, would we? And so because of this movement, tons and tons of Indiana women would call the governor's office to report their periods to him because it could have been a miscarriage and they didn't want to be on the bad end of the law there. And to be honest, this bill in Oklahoma reminds me a little bit of this, since fertilization is an unknown event and we don't know how many fertilized eggs ultimately don't implant. Women themselves and the people who have potential pregnancies in Oklahoma, they need to be on the lookout. And because we don't know whether fertilization is a knowable event or not, it does strike me that if your boss stresses you out, maybe you could sue them for negatively impacting your pregnancy. If somebody cuts you off in traffic and causes a little freak out, maybe you could sue them for potentially negatively impacting your pregnancy and aiding and abetting a fertilized egg not implanting. So, I'd love to brainstorm with some of you in the comments because I really think there's an opportunity here to clog up the legal system, or at least call the governor's office nonstop for clarification about this, because any period could be a missed fertilization event for anyone not on contraception and who's sexually active. And it just drives home the point of how little sense these bills make. Okay, so we covered fertilization being a problem. The next problem with this Oklahoma bill is that a lot of patients were trying to access abortion in Oklahoma who are coming from Texas, where their law with civil lawsuits started at 6 weeks or above. And distance traveled harms pregnant people. One is it requires time off of work, it requires the cost of travel, and often collecting and scheduling this event often means that the abortion would be later in pregnancy than if they had easy access to abortion. And also your options become limited. Over 90% of abortions happen the first trimester. Of these, most of them are medication abortions. And you can only get a medication abortion up until a certain point in the first trimester, and then you have to have a procedure. Although abortion is incredibly safe, the risks do go up with pregnancy. So it really negatively affects the health of not only people in Oklahoma, but also people in Texas, who Oklahoma was like the next geographic place for them. So it displaces more than even Oklahomans. All right, there are 2 exemptions to the Oklahoma law, but both of them are really problematic. The first exemption is for, life-saving intervention for the pregnant person. And as an OB-GYN who is a high-risk OB-GYN in training very soon, I hate that people think that this is easy. It is not. There is no list of medical conditions with precise diagnoses that are saving the life of the pregnant person. Some things are obvious. There are very obvious acute issues that are an acute danger, but there are many, many, many more medical problems that are in a gray area. And when you are starting to punish doctors for a vague interpretation of what saving the life of the pregnant person means, it is very problematic. A few examples for you. Unfortunately, I've had multiple patients during my career who are diagnosed with cancer during pregnancy. Now, some cancer treatment can be administered during pregnancy, but a lot of types of cancer treatments we don't do during pregnancy. Surgery, radiation, some particular types of chemotherapy. And so in order for a person to get the adequate treatment for their cancer, they have to not be pregnant anymore, either by giving birth, which is fine when the cancer is picked up at the end of pregnancy. But if the cancer is picked up early in the pregnancy, how much life endangerment is enough to justify the abortion according to this law? What if their risk of death in the next 5 years only increases by 15% by waiting throughout the whole pregnancy to initiate treatment? Is that enough, Governor and Oklahoma legislature? For me, it would be enough. Any shortening of the life or worsening of the prognosis for the pregnant person, I think is serious enough that that person, if they choose to, should have access to an abortion. But according to the law, if they're not going to die acutely during their pregnancy, it may not qualify. And doctors can't risk going to jail and being sued by a bunch of people. It really isn't clear. Additionally, there are other pregnancy complications where there is a much higher risk of death than if you were healthy, but the risk of death is still about 1% or 2%. That's overall a pretty low risk, but it's about 1,000 times the risk if you didn't have this disease or this illness. So is that a reason for maternal life endangerment or to save a mother's life? Who's gonna say? A lot of these people will not have access to abortion because their providers and themselves will be frozen in fear of either getting sued or, if the new law passes, potentially felony crime. And that is totally inappropriate. And if you don't think that these situations exist, please let me tell you that I see them all of the time. I see our multidisciplinary team of doctors in my high tertiary care center trying to decide if the very serious illness or complication that someone has is enough to justify, in Missouri it is waiving a 72-hour waiting period to get an abortion or not. It's really difficult. So this is not black and white, and politicians shouldn't be making decisions that are even hard decisions for doctors and patients to choose between and counsel about. The other exception is for rape and incest, but it's only if law enforcement is involved. So this is a huge problem. One is that often people who are victims of rape and incest are not believed and have a lot of trouble going to the authorities. So that's one barrier. The other thing is that even if they go to the authorities, even if they meet the criteria that it's an exemption and they can have an abortion, if abortion is largely illegal in the state and in neighboring states, where will they get the abortion? Where will the providers be? A first trimester abortion is straightforward as an OB-GYN. The medications are usually easy to access, but not always, because of other laws and other processes limiting access to one of the pills we use commonly in abortion. That the only reason it's limited, because it's really good for miscarriage too, is because it's also used in abortion. And the procedure in the first trimester is very straightforward. But if you have to jump through the hoops of first dealing with your trauma about your sexual assault and then reporting it to the authorities and getting your exemption, that's likely going to put you past the first trimester. And in the second trimester, you have to have a procedure. And whereas the procedure is very safe and it's not super complicated, you still have to have it via someone who trained with it. For example, I'm an OB-GYN. I do tons of really complex surgeries. An appendectomy isn't really a complex surgery, but I wasn't trained in it, so I can't do it. So even a procedure that's not super complicated, a person still has to be trained in it to do it. And if abortion is illegal in your state and a bunch of your neighboring states, where are the doctors that perform it? They might be really hard to find. They might only be in a place that's still really far from your home, and you may not be able to find that information on Google because these doctors don't want to publicize if they could probably be sued or accused of a felony. So even though these exemptions exist for saving the life of the pregnant person and for rape and incest, it still really negatively impacts care, even for these people who have exemptions to make abortion illegal. There's really no silver lining to these bills and to these limits. They will cause bad health for so many Americans. This bill does say that it authorizes doctors to remove a dead unborn child caused by spontaneous abortion, meaning miscarriage, or to remove an ectopic pregnancy. It also doesn't include Plan B or contraception. So I'm glad they have that portion in there. I want to point out though, I really hate the term unborn child. A fetus is not an unborn child. It reminds me of a weird zombie movie. The zombies are undead. What is an unborn? It's a really creepy term that has no definition and should not be used. I don't want to make this video too long. I will say a few other things real quickly about this that are important to recognize. I think for a lot of people who may have grown up in a Christian-centric, they may think that the narrative that life begins at conception is a biological fact or truth. And it's not. It's a religious belief. There is no discrete time period where life happens because trees are alive, right? So anything with dividing cells that's a unique organism is alive. In fact, a cancer in your body has rapidly dividing cells and the DNA is different than your DNA because it's mutated. The specialness of a human individual, at which point its morality and separateness is considered unique, that is a religious belief. Some religions believe that that point happens at birth, or happens at the 5th month of pregnancy, or happens at the quickening, which means that you feel fetal movement. The idea that that specialness begins when the egg and sperm meet, or when the pregnancy implants, those are religious beliefs. Other people don't have those beliefs. And so imposing the belief that life begins at conception or fertilization on people whose religion says that life begins at the point of fetal viability, that limits their religious freedom to do healthcare that is in line with their values and have access to safe and effective healthcare in line with their values. The other issue is that even for those who believe that life, a unique human life, begins at conception or at a certain point in pregnancy, there is no other situation where a human being can impose on the autonomy of an unwilling other human being just to prolong or even save their life. A really good example of this is that in pregnancy itself is not a health neutral event. By carrying a pregnancy, especially by continuing it to full term and going through birth and postpartum, there's significant medical risks involved. And someone shouldn't be made to go through that just to save a potential life. Similarly, there are many Americans, thousands of Americans that die each year of kidney disease that could be completely prevented by a kidney transplant. Someone who donates a kidney undergoes a health risk procedure, a surgery, and having only one kidney can put them at risk for having other diseases or illnesses in the future. Many people donate kidneys, and that is wonderful, but nobody is forced to donate a kidney to keep another person alive and to save their life, because it is part of their body autonomy not to have a procedure and a change to their medical history in their life without their consent. Similar with pregnancy. Pregnancy is a risk. There is often a big procedure and it can impact your life forever in a physical way, not to mention financial and emotional and etc. My op-ed goes significantly into the details about pregnancy is not a health neutral event. An adoption is not an alternative to pregnancy. Adoption is an alternative to parenting. I'll link that op-ed down there if you want to read it. I discuss a lot of data and I have direct links to data for that. But I just wanted to remind people that life beginning at fertilization and conception is a religious belief. And even in that, the concept of that religious belief, nobody should be required to have a violation of their own body to save another life. And that's where when people talk about body autonomy, that's what they're talking about. We're not forcing people to give other people kidneys. We shouldn't force people to have to carry pregnancies. So anyways, I Hope you found this educational. Many of you have been begging for me to kind of put all in one place a lot of the things I've discussed on Instagram about abortion into a video. Clearly this video is not fully comprehensive, so you can also see my abortion highlights on my Instagram for more information. We are going to a place where a lot of pregnant people will die and get really sick if they're not able to access abortion in our country. And we know that based on data. We know it because abortion has already unfortunately been difficult to access for many Americans for a long time, as many states have imposed restrictions, closed abortion clinics, etc. And I'm really disappointed to see that that's going to happen. It kills me when my patients suffer, and I've already seen so much suffering from this, and I know I'm gonna see more. And if you'd like to engage in meaningful conversation with me, please comment below. Don't forget to subscribe. I have educational videos about pregnancy and birth every Friday. Thanks so much for joining me. Take care.